welcome to Channel 68 News. I'm Nate Bond.
I'm Will Maddox.
And this is our Health Spot. Today we will be discussing pharmacists joining the clinical team. It's going to be great.
It's going to be great. The reason we want pharmacists to come down and join our clinical team is because there's $17 to $29 billion spent each year correcting medication errors. 17 to 29. And at least 44,000 people die each year as a result of those medication errors. Nate, that's too many people.
Pharmacists are in the hospital. Why can't they be at the bedside with the nurse for actual patient care with us?
Wait, so you're telling me that the pharmacist is just a few floors away from where we're up to our elbows in
sadness. We're up to our elbows in sadness with the fact that there's such a huge disconnect between the pharmacist and the bedside.
Nurses know that in the middle of a hectic day, it can be difficult to find time to get a pharmacist on the phone to ask a question. As nurses, we would like the pharmacist to be more accessible for our patients and the questions they have about their medications.
I understand that doctors are constantly wearing their earmuffs, and nurses are always pretty busy, and they could always use a little bit of help so mistakes don't happen.
We're looking at you, LPNs.
We have seen great strides with the 100,000 Lives campaign, but what else can we do? In order to improve patient care, we should incorporate a bedside pharmacist into the clinical team.
According to a study done by the World Health Organization, half of all medications are prescribed inappropriately, and 50% of all patients fail to take their medications correctly. I think that's a problem.
That's a big problem.
A study found that a clinical pharmacist identified almost 80% of medication errors that were made in the clinical setting. Physicians also implemented at least half of pharmacists' recommendations when it came to patients' medication regimens.
With that being said, we think it is best practice to include a pharmacist as a member of the clinical team for improved patient safety, better patient education, and to prevent medication errors.
So come on down and join the fun that is the forced, awkward, intimate setting that we call the bedside.
What is a hoot? That does it for our Health Spot this week. Thanks for joining us. I'm Nate Bond.
I'm Will Maddox. Stay healthy, San Diego.
I'm the only one who could ever reach me, for the son of a preacher man. The only boy who could ever teach me was the sweet talking son of a preacher